Hi, Minda.
Hi.
So nice to see you.
It's good to see you.
My name is Catherine Walker, and I'm going to be your counselor for today. Through this whole thing, I'm going to ask you a whole lot of questions.
Mm-hmm.
Some of these questions might be uncomfortable or awkward, or maybe you don't even want to answer them, and that's okay. If there's a point in time where you're going through this and I ask you a question and you just want to skip it, just let me know. We'll skip it, and we'll come back to it if you want to come back to it later, but if you don't want to come back to it, that's okay too.
Okay.
Have you ever heard the word confidentiality before?
Yes.
Okay, can you tell me what that means?
Like whatever I say, like with you, just stays in this room.
Yeah, so it's kind of like that. There's a couple exceptions to that rule. So confidentiality, you're right. Things that you say are going to stay here, and that'll be between you and I. But there's like 4 exceptions to that rule. So if you say you're going to hurt yourself or hurt somebody else, I'm going to have to let somebody know for your safety and for theirs. If you say that you're going to hurt a vulnerable population, which that could be children, developmental disabilities, and the elderly population, I'm going to have to let somebody know. And then if the court mandates documentation, then I'm going to have to provide documentation, but I'm going to provide as little as possible. We're not trying to give your information away. And then I am a grad student, so I am underneath supervision, and I'm going to consult with them to give you the best care that is possible. Do you have any questions?
No.
Okay. I know I threw a lot of things at you. So identifying information. So this is going to be a bunch of questions. This section will just be questions about your basic demographics. So name.
Amanda Tuttle.
Okay, can you spell your last name?
Tuttle.
And then, so if you see me writing and it ever becomes distracting, just let me know. I'm just going to write so that I can remember things and know you a little bit better. And so your age is?
35.
Okay. And date of birth?
April 8th, 1986.
Okay. And your gender?
Female.
And do you have preferred pronouns?
She, her, hers.
And what race do you identify as?
White.
And your marital status?
Single.
Okay, so you brought some paperwork with you today.
Mm-hmm.
So I'm going to go over some of this paperwork with you if that's okay.
Sure.
When you were filling this out, did you have any questions about some of the answers or anything?
No.
Okay, so I'm going to start with the patient health questionnaire that you went over. So I see that you wrote that you had little interest and pleasure for doing things nearly every day.
Mm-hmm.
How's that been going for you?
It's just been really difficult. Like I just recently lost my job, and I think I just been feeling really depressed, and it just makes me not want to like do anything. I just kind of find myself like kind of in a dark place. Just want to hide away, in my bedroom or whatever, and shut out the world. Yeah.
Those are some really big, hard things.
Yeah.
I'm going to keep going through some questions. So, see that you've been feeling down and depressed or hopeless nearly every day. Can you tell me a little bit more about that?
Yeah, I mean, like, just, feeling, I guess, bad about myself for having lost my job, and not being able to find another one, and worrying about how I'm gonna take care of things. And then I guess my way of dealing with it is just kind of shutting down. So it's been like every day. It's really hard.
Yeah, that is hard. Those are big events, losing your job and how that's affecting you. See that you're having trouble falling asleep or staying asleep, or even potentially sleeping too much.
Yeah, I think it's probably more like the sleeping too much. Like, just like I said, I think I am shutting down, like kind of just retreat into my bedroom and just sleep, like shut out the world.
Yeah, that's difficult too.
Mm-hmm.
So based upon scoring wise, it looks like we're looking at potentially some moderately severe depression based upon this assessment, but we're going to ask some more questions on that. It's see that you put you're having difficulty with these problems affecting your home and we're getting along with people, and you said it's very difficult. Can you tell me more a little bit more about that?
Yeah, so yeah, I just struggle, like, I feel like my family and friends like want me to like go out and do stuff with them, and because of the way I'm feeling, I just kind of shut them out, and then like they don't understand, and yeah, it's just it's been frustrating. I mean, probably for them too, but yeah, I just haven't been like engaging with anyone really.
Yeah. I hear that is frustrating how it's affecting your relationships. That's a big thing. So I'm going to look at the other one. So this one was a generalized anxiety disorder screener. It looks like you were feeling nervous or on edge several days, and you worried too much about different things, several days as well.
Yeah, I would say probably, when it comes time to pay bills, I start to get a little bit worried because of like not having a job, and like having a hard time finding a job because I feel so bad, and yeah, so I guess when I'm not like shutting down, I'm worrying a little.
That's really valid. There's a lot of financial stress. It seems like you're experiencing. Move on to the next question. So it seems like you're becoming easily annoyed or irritated several days.
Yeah. I think it's that, my family, like I said, they just don't really understand, and so I get like aggravated with them, and then it's just really hard for me to spend any time with them. Like, just I don't want to be around anyone because I just get mad at them, and then I feel bad for being mad.
Yeah, it's really valid. It's really hard. It seems like you put these to make it difficult taking care at home or getting along with people, which you kind of talked a little bit about how it's been affecting your relationships, and you said that's somewhat difficult. So scoring wise, it looks like you said it's been going for 2 weeks. Is that when you lost your job, or has that been more recent?
Yeah, it was when I lost my job.
Okay.
I mean, I feel like it's probably gotten worse, but yeah.
Okay. Looks like you're not scoring for anxiety, but definitely experiencing some anxiety related to that loss of job. So I'm gonna have to. So this assessment has like a whole host of questions that I'm gonna ask you, and they're gonna be sometimes redundant, and there's gonna be a whole lot of questions. But how would you describe the symptoms or difficulty that you're experiencing?
I guess like feeling like low self-esteem, not feeling like good enough, like as I'm looking for other jobs, just feeling disengaged from everybody, from life. Like, I think the way that this last job ended really affected like how I feel about myself or how I see myself, and yeah, it's just I think my way of coping is just to like shut everything out, and sleep, and just it doesn't like fix anything. So then when I have to pay bills, I get anxious. But yeah, I think just emotionally everything is kind of dark. Like
Yeah, that's a lot of stuff to be walking through, especially after losing a job. It seems like it's pretty difficult. I'm gonna move on to some next questions. So when did this problem start?
So probably a month ago I lost my job.
Okay. And you'd say that the losing of job is what started some of these symptoms.
Yeah. I mean, the job itself was kind of an unhealthy like working environment, and I'm sure it didn't help me like with like my self-esteem and stuff, but then like losing it made me feel even worse.
Do you feel like these symptoms started prior to losing your job?
I think like the environment of my job made me feel like I was like I guess I was worried that I was going to be let go because of the way people made me feel like I wasn't capable of doing my job. And so, like, probably my self-esteem was affected beforehand.
Okay.
Yeah.
And when would you say that your self-esteem started to become affected?
Gosh, I mean, I guess I really noticed it when somebody who was previously, like, not even in my area was, like, placed over me as, like, a manager, but, like, nobody told me about it. They just started kind of acting like they were my supervisor, and I'm trying to think of when that was.
Can you imagine that was frustrating?
Yeah.
To have that new person put above you.
Yeah, since it wasn't like an official, like nobody told me when it was, like that it was actually happening. It just kind of happened. So maybe a month or so, but yeah.
So a month prior to the...
Before I was let go, yeah.
Okay, so you'd say about 2 months.
Yeah.
Okay. Okay, so with these symptoms that you're experiencing, is there anything that makes it better or worse?
You know, I would say, like, getting outside. Normally, like, I would love to be outside, but as it's gotten colder, like, it's harder to get myself to go out there. But yeah, like, usually being out in nature helps me feel better.
Okay.
Or listening to music, I guess.
Those are really good ones. Those are good things to help. Anything that makes it worse?
You know, when those bills come around, I think that, you know, it makes me anxious, and then I, like, shut down more. I think that's it.
Yeah, so financial stress is a really big thing. How has the problem impacted you?
I mean, it's definitely made me, like, do less socially, not hanging out with friends and family anymore, really. I don't feel like I'm taking care of my house the way I should be, you know, just feel like I have no energy to do anything, or like willpower, I guess.
Yeah, those are really big things too. It's hard to navigate all these different things. What have you done to try to solve some of these symptoms, or like even the loss of the job?
Yeah, I think I thought like finding another job would help, but it's been really hard. So I guess that's even something that's like, you know, I try to find a job, but then when it doesn't work out, you know, like it just makes me feel worse about myself.
That's valid. So I have some more questions. So this has to do if you've ever been in counseling, things like that. So are you currently in counseling or even psychotherapy at another site or anything?
No, nothing like that. No.
Do you have any other symptoms or experiences at this time that you're experiencing?
No, nothing I can think of. Nothing out of the ordinary.
Okay. So I'm going to ask you a little about your family.
Okay.
So I know you said there's been some strain in your family relationships, but so tell me about your parents, siblings, things like that. So parents.
Yeah, so my mom is divorced from my dad, and she is remarried. They've been together, oh my gosh, like 20 years or something like that. And I have a brother who is younger than me, and he has suffered from like anxiety, and has seen a counselor for that. I'm not sure like if he's on medication or anything. Yeah, and then my dad is like, we don't really talk, but he, you know, was in the area.
And what's mom's name?
Terry.
Terry. And dad's name?
Steven.
And brother's name?
Tyler.
Okay, great. And you said is it just your brother? And he's younger?
Yes.
Okay, great.
Yeah.
Okay. And you said that mom is remarried.
Mm-hmm.
Is stepdad in the picture, things like that?
Mm-hmm. Yeah, he's nice.
And what's his name?
Kevin.
And you said they were married they're married for 20 years?
Like 20 years.
Okay.
21 years. Oh, that should be easy. 2000.
Okay. Is dad remarried?
No.
Okay. And your history with your parents. So, what is your relationship like with your parents?
My mom I'm like really close with my mom, but maybe almost in an unhealthy way.
Okay.
She can be really negative.
Okay.
Even though, like, it probably doesn't help, like, my situation. But we do a lot together, spend a lot of time together. And I'm sorry, did you ask another question, or?
Yeah, so dad and stepdad.
Oh, dad and stepdad. So my dad, we had a tumultuous relationship. It's been like back and forth, sometimes we're okay, sometimes we're not. Right now, like, we don't talk a lot, but, I try to touch base with him here and there.
Okay.
And stepdad, we get along just fine. We don't, like, hang out one-on-one, but, like, yeah, we get along.
How is your relationship with your brother?
It would be great. He lives in Cincinnati, so it's kind of far, and we don't talk a lot. He's not, like, the most social person in the world, so we don't talk a lot.
Okay. And what is mom and dad's relationship like?
They surprisingly, I would say my mom, likes to make sure that my dad is okay. I don't know when that was. Yeah, so my mom likes to make sure that my dad is okay, because he has some physical health problems. But I would say the other way around, like, my dad, he doesn't have, like, hard feelings for my mom, but a lot of times, like, he'll get into stuff about the past and he'll blame her for things when we're together, so, which is part of why I don't like to hang out with him a lot, but
That's good.
yeah.
So you said you're not married. Do you have any children?
No.
Have you ever been married in the past?
No.
Okay. Then I'm going to move on to the next section. So your parents are both still living, and you have a good relationship with your mom and dad, back and forth is what you said. And you're not married. So you have any emotional symptoms or problems that are affected by your family, or are they a support to you?
Well, I don't really feel like they understand, like, why I'm taking this job thing so hard. And sometimes it feels like my mom kind of treats me like a kid still, which is why I was kind of like, our relationship might not be healthy. And my dad is like, our relationship is almost, he offers to help, like, financially, but, like, our relationship is kind of the opposite emotionally. Like,
yeah.
I feel like I'm checking on him to make sure he's okay, because of his health and everything. But,
yeah.
but he's not really like emotionally supportive,
Okay.
I guess is what I'm saying.
Yeah. So I'm gonna move on to the next one. So this has to do with kind of childhood. So did you have any complications at birth or during childhood?
I was actually born like 11 weeks early.
Okay. Did you have any complications from being born early?
I think like I was on a heart monitor or something about like I would stop breathing and like I was in an incubator. It would like shake to get me to start breathing again.
Oh,
I
okay.
don't really understand it all, but yeah. Like I was in the hospital for at least a month after I was born.
Oh, okay. Did you have any complications after that?
No.
Any complications during childhood?
No. Like
Health?
like
Anything?
health?
Yeah.
No, nothing like that.
So, did you have any developmental delays in like any milestones of walking, talking?
No,
Nope.
nothing at all.
Did you have any childhood disorders like separation anxiety or ADHD or anything like that?
Nope.
And then did you have any problems like bedwetting, tics, stirring, nightmares, things like that?
I mean, I had nightmares a lot, but I didn't know if that was different from anyone else.
How frequently would you say you experienced nightmares?
When I was a kid, gosh, I don't know. I feel like it was a lot. Like we had stuffed animals that I would like sleep with to help me feel better.
Yeah.
But yeah, I don't.
Okay. So I'm gonna move on to the kind of like education history. So what formal education do you have? So highest level of education.
My highest level is bachelor's.
And you have any specialized training or skills?
I mean, I do graphic design. That was my degree.
That's a really good one. So are you currently a student or taking training courses?
No, I'm not a student right now or anything.
So what was school like for you? Kind of thinking K through 12. What was that like, and what were your typical grades?
I did well in school. I got good grades most of the time. I feel like I tried to get along with everyone. I mean, I got teased a little bit in elementary school.
What were your relationships like? And
I just had like a couple like really close friends, and then I just kind of feel like I got along with most everybody.
okay, great. Okay. So you said you are not currently employed.
No.
So how is your presenting concern impacting future work?
I think it just brings my like self-esteem down, which makes it harder for me to like even apply to jobs, because I read through the job description and I just think like, oh, I can't do that, or I'm not good enough, or they aren't gonna pick me, kind of thing.
Yeah, those are hard things to feel too. What is your job history?
So I worked in a church for like 6 years as a graphic designer, and then left that job and worked for like an e-commerce company doing their graphic design for like 2 years, and then from there I got a job with the company that I just got fired from, and I had been there for 4 years. And they were like a creative agency.
Okay. So for you, I'm going to ask you some about psychiatric history. I know you talked about it a little bit earlier. So have you ever received treatment or been hospitalized for any emotional or mental needs or concerns?
No.
Okay. Baseline functioning. So what is your baseline functioning prior to experiencing some of these symptoms prior to the job changes and the job loss?
Yeah, so before, I feel like I went out more. Like, I would say I probably, like, every weekend went out with friends or family. I was, like, going to church, and I don't know, I feel like I just enjoyed life more.
Yeah. Okay, and does your family have a history of mental or emotional disorders of like mom, dad, brother?
So my brother has anxiety. And my dad has bipolar 1.
Okay. So I have this next assessment that might feel a little uncomfortable, and some of the questions might even feel a little bit redundant. But it's a suicide screening tool, and this is just for your own safety. And again, if at any point you feel like you're uncomfortable and you want to skip a question, just let me know, and we can either come back to it or just skip over the question. So, in the past few weeks, have you wished you were dead?
I don't know if I would say wish I was dead, but I definitely, like, questioned, like, what the heck I'm doing. Like, feels like life is pointless.
Okay.
But I didn't, like, wish I was dead.
Okay. So you would say no, you don't wish you were dead?
No.
Okay. In the past few weeks, have you felt that you or your family would be better off if you were dead?
No.
Okay. In the past week, have you had thoughts about killing yourself?
No.
And have you ever tried to kill yourself?
No.
Okay. So I just have a couple more questions. I know they might be the same questions. Are there times when you think about hurting yourself?
No.
Okay. And sometimes when people are experiencing some of the symptoms that you mentioned, they begin to think about suicide. Have you ever thought about suicide before?
No, I haven't thought about suicide.
Okay. And so said you hadn't. So, has to do with some impersonal violence, and again, if you feel uncomfortable, let me know. Has anyone ever hit you before?
No.
Have anyone ever verbally assaulted you, yelled at you, or called you names?
I mean, I got made fun of in elementary school, like called names, I guess.
Okay. And then has anyone tried to monitor, control your actions, friendships, or interactions with others? So, has anyone tried to control your actions?
No, I don't think so. I mean, not like, parents do to an extent, but...
Yeah. Okay. So for past medical history, I'm going to ask you some questions. Do you have any significant weight change, so gain or loss?
No.
In this last year? And then, okay, great, you said no. So past health concerns and present health concerns. Do you have any health concerns?
I think just, that I was, not sleeping, I feel like, or sleeping too much, maybe. I don't know if, like, this is a health concern, but I feel like I struggle to, like, pay attention to things.
Okay, and are you currently being treated for any conditions?
No.
And any medications?
Like, I take vitamins.
Okay. And then this part might be a little uncomfortable, but I'm going to ask you about your sexual history.
Okay.
So how would you describe your sexual orientation?
Straight.
Okay. And you ever engaged in sexual relationships?
In the past.
Okay. And were they safe sex practices?
Yeah.
And are you satisfied with how things are?
Well, I'm not in a relationship right now, so.
Okay. And then are your current, I know you said you're not in a relationship, are they currently affecting your sexual functioning?
I mean, nobody really feels that, you know, if I feel really bad about myself, it certainly probably wouldn't help the situation.
Okay. So maybe some of that lower self-esteem. So have you, I'm going to ask you about drug use, and do you ever or currently use nicotine?
No.
Alcohol?
No.
And any other drugs, like marijuana, opioids, heroin?
No.
Okay, and then I'm asking about social hobbies. So what are some hobbies and interests that you have?
I used to like paint a lot, and like go to parks and stuff.
Okay, and then do you have a religious or spiritual affiliation?
I used to go to church. I was really involved in church, but I haven't been lately.
Do you have a specific denomination that you follow, or?
Not really, just Christianity,
Okay.
I guess.
And are you involved in any organizations?
No, not right now.
And friendships?
I have a couple close friends, but I had a couple close friends at my job that I don't, see anymore. And then I had a couple close friends, in general, and, that's fine, but they, are married and, busy with kids and stuff, yeah.
So are you having are they hard to maintain?
I mean, it's hard, but I think that's part of being in your 30s.
Yeah. Are you satisfied with your level of involvement in social activities?
No, I mean, I feel like I'm not engaging like I used to because of how I feel, and it's really hard for me to have any ambition to see people.
Okay. Which I'm imagining could be difficult too. I have some more questions for you. So, are your current symptoms interfering? You kind of said yes to this. Is in your life of that interfering with that self-esteem and not engaging as much?
Mm-hmm.
Which of these social activities are sources of support for you?
I think church was when I went to church. And I mean, it's hard because it's I just don't want to go out and do things, but I think in the past, my friends have been supportive about things.
Okay. It's good to have supportive friends. So are you previously or currently in the military?
No, I'm not in the military.
Okay. I'm going to ask you a little about legal history.
Okay.
So are you have interactions with law enforcement or the judicial system?
Nope.
Okay. Have you ever been arrested or spent time in a correctional facility?
No.
Okay. I'm going to ask you a couple questions. So can you tell me what today's date is?
November 1st.
Okay. Who are you?
I'm Amanda.
Okay. And where are you?
I am at the mental health clinic.
Yeah. Who am I?
Catherine.
And what are we doing here?
Having a counseling session.
Okay. And then I'm going to ask you to remember some words. Are you ready?
Yes.
Duck, library, and car. Who is the current president?
Joe Biden.
Okay. And who was the president before Joe Biden?
Donald Trump.
Okay, and tell me those 3 words.
Duck, library, and car.
Yeah, that's pretty good. So that's all I have for you today. Do you have any questions or things you'd like to go over?
I don't think so.
Okay. Okay, well, it was nice meeting with you.
Yeah, thank
Enjoyed getting
you.
to know you.